Welcome to the AUANews Inside Tract podcast. Today's Inside Tract podcast is part of the Voices series, which is brought to you by the Diversity, Equity, and Inclusion Committee. Here we'll be joined in conversation with committee members, AUA members, and urologists from around the world to discuss how to build a strong, vibrant, and diverse urological community.
So thank you for listening to Voices. My name is Dr. Andrew Lai. I'm a chief resident at the University of Illinois at Chicago. I'm also author of the AUANews article, My Journey as an Out and Proud Urology Resident. I'm happy to host today and talk with you with my fellow co-chief, Dr. Rabun Jones.
Hi!
Thank you so much for doing this for me and doing this with me, because I think when they invited me to do this, like, your name was the first thing that popped into my head, and I was like, I need to have a conversation with you.
Well, it's my honor. Oh gosh, yeah. Well, thanks for having me. And yeah, whenever you ask, I'll be there in a minute. So we should make a couple disclosures. Yeah. The first is that we're unnaturally obsessed with each other. So we're both 6th year in our final year of residency at the University of Illinois, and our program is a total of 12 residents, so there's only 2 of us per year. So you and I are twins,
Joined at the hip,
spouses.
Yeah.
Like, not every set of 2 residents, not every class is like this, but for whatever reason, we decided that we were. I think, like, the moment I met you, I was like, okay, yeah, this is it. We're good to go.
Can I tell you, like, actually,
No.
when I first met you and I found out that you were from South Carolina, I actually was very scared of coming up to you.
Oh, for sure.
From the very get-go, I was like,
Yeah.
oh, like, this girl's from Carolina.
Yeah.
Tell her right off the bat. And thank you so much for just being so open, because immediately when I met you, I was like, oh, perfect. The next 6 years are going to just be fantastic.
Yeah, I'm going to cry already. Waterproof mascara.
Oh my God.
Put that on. Yeah. I mean, there's a reason I hide my accent. Like, there's a reason I try really hard not to have a Southern accent, is because there's so much that's associated with that and the sort of baggage that comes with that, which is probably another discussion. But yeah, I hate that, and I understand that. But anyway, yeah, I thank you for being you.
Thank you for being you. No, I had to brag about Raven for 1 second. Like, it has been 6 years since I've known you now. And in the last 6 years, one of the things that really stands out to me is that your voice as a person, as a surgeon, as an advocate has really solidified and really kind of become something with such conviction that I am so proud of. Like, wait, no, I'm serious. Like, I am so proud of you and, like, the work that you do for us as an institution, us as a field, us as, like, a specialty. Seriously, no, but seriously, how do we get here? Because that's something that I feel like we can stand at the end of residency and look back and kind of reflect that.
Yeah, for sure. So
yeah, let's take it.
We're at the end of our residency training. We graduate literally like 6.5 weeks. And you're right. Yeah, these 6 years have been intense. They've been really formative, which I think is the point, right? You're supposed to be formed into an independent urologic surgeon. But at least for me, and I don't want to speak on your behalf, but I do think for you too, it's been a time of evolution and, like, really learning who we are, learning to accept who we are, and finding strength in that. At least for me, I know that I really leaned into therapy because I realized that I wasn't going to be okay without it. And I tried my best as hard as our schedules were, and thanks in part to you for covering so I could make it to my therapy appointment, and really lean into that. And I think, well, I have to credit my therapist for, like, all the work that she has done on me. I keep her really busy. Our residency keeps her really busy. But yeah, it's been a journey, and I think we're going to dive into that. And I, have to say thank you for the recognition. It would not have happened without the work and support of, our colleagues, our faculty, but especially you. Like, yeah.
Okay. We could go on all day.
Yeah.
No, seriously though, but I'm embarrassed a little bit because it wasn't until pretty recently that I found out that you identified bisexual.
Well, same. Yeah.
Okay. Tell me more.
Right. Yeah. Okay. So I have been married to my cis male. He's very straight, actually. Oh, we love him. Yeah. Partner, my husband now. I've been with him for 18 years and we're about to celebrate our 13th wedding anniversary because we just figured if it ain't broke, like, don't fix it. We got married at 21 and he's a physician too. And we eventually were able to match in the same city and end up in the same place. So yeah, I present very straight in that I'm partnered with a man, but also I thought I was straight for the longest time. And I think our journeys are a little bit similar in that way that like our relationships sort of defined or even help like us understand our sexuality. And so for me, I didn't know that I was attracted to women until that became like a possibility in my brain. Which honestly was during residency. Yeah. So if you look on like bi TikTok, like you'll see like there were always signs like the bi girlies are like, oh, were you attracted to the female in Atlantis? And it's like, well, yeah, maybe. Like, was Jessica Rabbit the reason you watched Super Rabbit? Well, maybe. Yeah. So anyway, like there were always signs, but I think recognizing those and allowing myself to be that way and allowing myself to understand myself, giving myself the space to realize, okay, this is a part of me, and then accepting it, right? Because you can realize that it's a part of you. Obviously, it doesn't define you overall, but then sort of being like, yeah, like it's okay that this is part of me. And then, of course, reconciling that in your relationship, which is a whole thing. But like, I'm not partnered to someone that instantly makes someone understand that part of me, whereas you are. So you're partnered with a man. And as soon as I knew that you were partnered with a man, I was like, oh, duh, awesome, amazing. And then that was just like one more piece of the puzzle that like makes you, right?
Yeah.
But once you revealed that piece of information to people, you weren't just revealing who your partner was, you were revealing an important part of your sexuality. So
I guess
how did that?
A little bit different from how I guess your day to day at work.
Oh yeah.
Like, I mean, does that intersect at all with anything that you do on a day to day basis?
Well, for me, I think because I do present as straight, and I have patients, especially all the time, ask me like, "Oh, are you married?" I don't wear a wedding ring. I do have a tattoo, but I will have patients or colleagues or whoever else like, oh, are you partnered? Are you married? I'm like, yeah, I have a husband, blah, blah, blah. I'm not going to be like, but P.S. I'm bi.
Yeah.
Because that's not the question they ask.
Right.
And so because I present as straight, I have found that people will sort of allow themselves to be a little homophobic around me and to make let a bigoted comment slide, let a homophobic comment sort of come out because I feel like they're in a safe space for that to happen. And I will say that we should specify that the treatment, any sort of negative or discriminatory treatment, has been for me from patients and not from faculty members. Yes, we should specify that, especially at U of I, like at UIC, our culture is incredibly welcoming, incredibly supportive, inclusive. I had never had any reason to hide my sexuality at work, and it was never something I intentionally did. But in the middle of operating, I wasn't going to tell an attending, oh my God, guess what? I like women, you know?
It just seems unnatural.
Yeah, and that's the important specification, I think, for me, is that I think a lot of bisexual people are pan or are, we're attracted to human beings. It is completely different for everybody, and it's really difficult to use labels sometimes. But at least for me, I fell into that space of like, I'm attracted to like the person and not the gender. I don't know if anyone watches Schitt's Creek, but the episode where
I know exactly what you're talking about.
it's like, I like the wine, not the label.
Right.
It's like, I like red wine. I like white wine. I love a rosé. Love Prosecco. Incredible. Yeah. But that realization for me was really from moving to a more like a liberal environment, right? Being surrounded by people who were different from me, and then realizing how maybe I was different from my perception of myself. So
there was also no necessarily, at least at U of I, we feel like we have a freedom to be who we are.
In our program.
Yeah, in our program.
For sure.
And our faculty and like the people that we work with on a day-to-day basis really take you for who you are. And that's just another adjective along with a long list of other adjectives when we're at work.
Oh, for sure.
It's not the defining characteristic or anything like that.
No, it's not. But like, what do you think? Like, how do you think your sexuality has played a role into performing your job, your ability to perform your job? Like, obviously, we're dealing with things outside of work, but maybe specifically at work.
It's interesting because we're operating, right? And so much. I feel like so many conversations happen when you're operating over someone who doesn't know that you're talking about, or like, not we're talking about that, but like so many of our conversations happen when we're talking over someone who's completely asleep, right? And so when we're completely unrelated,
it's true. Yeah,
that's where a lot of our small talk happens, and then a lot of times,
or in clinic between patients.
Oh yeah,
we're fully dedicated and focused on patients at all times.
Yeah,
it's specified.
But in all seriousness, like I remember at the very beginning being so afraid of coming out to and attending and just being like, oh yeah, well my partner is doing XYZ and he does and he wants what, like having that conversation and then kind of almost bracing internally for what their reaction was.
Oh, for sure.
Which in retrospect is completely ridiculous, right? We have a very supportive faculty. We do vaginoplasties and perform gender care at our institution. Like, I mean, of course, I don't like when I look back on it, I'm like, why was I ever concerned about that? But recognizing that it's not always the case for everybody, right? And everybody's in kind of a different mental headspace, and also a different physical space. And it's like, but we just are fortunate to be in that space. So, when I'm in the operating room, I feel like when I'm talking about people, I feel like the more natural that I come across, the more matter of fact it just happens to be. And I think part of it also is recognizing, I don't know, every time we start in the operating room, I need to make sure I know everybody's name, right? So if there's a new anesthesia resident, oh, I haven't met you. Are you CA1, CA2? Like, let me get to know you a little bit. Or let me get to know the nurse. Or, oh, there's a nurse trainee. Hey, what's your name, right?
I see that not everyone's like that.
No, but it helps in building not only just like team dynamic in general, right?
For sure. But that's like a superpower of yours. Is it? No, shut up. Don't argue with me. I'm in charge.
Okay.
No. Like it's a superpower of yours that you're able to make everyone feel included in part of the team. Like you're so good at it.
But is part of it, I think part of it is maybe a defense mechanism too, because it's almost creating the space for me to be comfortable and saying, hey, I'm gay. Right? Like, and it's almost like hey, I care about you as an individual. You're not just anesthesia, or you're not just nurse. You're not just tech. You're person X, for for Noemi, you're
person.
You're Calvin,
God bless one. Oh my God.
But it's really creating that space and really like making whoever I'm working with human, so that then also in hope they may be reciprocating for me if that ever comes up in conversation.
That is so sweet. I feel like I just plow people down. With my personality.
I don't know. I don't think that's true at all.
I'm just like, this is me. Take it or leave it.
I mean, to a certain extent, you have to be that way, right? You have to be very matter of fact. And I
think it's a woman too. I think that plays a role.
That's big. Seriously, no. But like specifically the surgeon and as a female surgeon, it's almost you have to be matter of fact, take it or leave it, because there otherwise would be people who will be challenging it. Either consciously or unconsciously. Right? And so it's almost like setting myself up for success and being that kind of person. That makes it sound disingenuous, but it's really not. It's like a genuine interest in being a team player and being
which serves everyone. It's not self-serving.
No.
Like, it serves everyone in the room, every member of the team, so we can all work to ultimately do our job, which is to help the patient.
Right, exactly. And if we all function to like as a team, like we seen positive outcomes when, you know, everything functions like clockwork. And, you know, everybody kind of just is doing their thing and the patient has fantastic outcomes afterward. I've also been part of teams where, you know, like things haven't worked out well and it may have to do with team dynamics and stuff like that, right? So I think kind of just getting to know people and really setting them up and saying, hey, like, this is who I am. I see you for who you are. Yeah. Let's work together.
Yeah. So beautiful.
No.
When you have those conversations, though, like, do you find yourself leaning on your partner as a way to open that door? Like, how often are you like, hey, I'm gay? You know?
Oh, that's true. Absolutely true. Right. I'm definitely leaning on my partner. And I know that a lot of people may not have
like
that, right?
Bringing up the fact that your partner.
Right. Or like, hey, we just went on vacation last week. Or something like that. Yeah. And he, you know, exactly. I definitely do. And that's kind of a conduit to just say, listen, I'm just living my life. Right? And I'm telling you about my day just like I would expect to be like, hey, how was your weekend? Like, what did you do? Right. And that's just part of our day to day.
Which is magical, I must say, because I think coming from a background, and this is no shade, obviously all of South Carolina is not one homogenous Republican place or homophobic place or whatever. But I will say that coming from a background that was overwhelmingly conservative, it's no secret that like it's a conservative state overall. And then coming from that background, I think just seeing human beings out and about living their life and seeing members of the LGBTQ community like actually existing was honestly for me the most validating thing, and ultimately like making me feel more comfortable accepting the, you know, different parts of myself and, you know, like living that a little bit more out loud. Like I think that just hearing someone talk about, oh, you know, myself and my partner who happens to be a man, no biggie, is like such a beautiful way of like maybe introducing those who may not be as comfortable with the idea of human beings existing that are different than you, which I have to say is, you know, many of them are here in Illinois, but many of them are also across the country. Like it's such a gorgeous way of being like, yeah, I'm a human being. I get to do this just like you do.
Yeah.
And it's like normalizing it, but also that's a big thing for you.
God, I wish you were here like when I was in college, because I had at the beginning of residency, I had so much internalized homophobia. And I think it had a lot to do with that. Like, it had a lot to do with so many expectations and of who I was supposed to be as a person, as a surgeon, and whatever. That I really adopted that perspective, and it wasn't until I was in a space like Chicago, in a space like UIC, where I'm just watching people and I hear people kind of just living their life and just being a part of a bigger picture of who they are as a human being. That really was what really I think was a big turning point.
I think that's what changes hearts and minds across the board. Honestly, I really do.
Wow, so visibility matters.
Yeah, visibility matters.
Really matters.
Where are your rainbows? Like, 100%. Like, I think that is relevant from a diversity, equity, inclusion standpoint. No matter what that difference is, like whatever that is, but however you're a minority, however you're a historically marginalized person or part of a historically marginalized community, like visibility, seeing someone do the thing you want to do, or seeing someone be able to sort of live their life, be fulfilled. And you're like, wait a second, you mean I can be both a surgeon and gay? I can be both a surgeon and female. I can be both a surgeon and trans, like whatever that is. Like, I think across the board, like if you don't see it, you can't be it, or at least it's really, really hard.
Really hard. I completely agree.
Did you have like Asian mentors? Did you see gay men like in urology? Like when you were trying to decide, this is what I want to be, like, did you see yourself?
You know, I had a couple of examples where they were kind of more quiet and a little bit reserved. And I shouldn't say that. That's not fair. They were less visible, right? And they weren't necessarily visible to me either. And so it really was, I think, for me, research year during our 4th year, where we kind of just had the mind share to think about everything. And I think at that point, I was really I had a moment where I was like, okay, I need to intentionally decide what kind of surgeon I want to be, what kind of person I want to be. I've got 2.5 years left of residency, and I'm about to go into a world where it just seems so big and scary, right?
Yeah.
And so it was a very big intentional moment for me to say, you know what, I think I do need to put this on my sleeve. I do need to make this visible, because maybe some people don't have agency to do it.
Yeah.
Otherwise, right? And I have to just be who I am. And who I am is not hiding the fact that, yes, I have a male partner who's been supportive of me for almost 8 years, right? Who's seen me through medical school, who's seen me through all of residency.
Shout out for real.
Oh my God.
Yes.
Like, let's just that was a big part of my support network. And so, and it's become a huge part of my identity as well. So to completely ignore that when I'm at work and as a surgeon, and to be uncomfortable to say, oh yeah, last weekend my partner and I went to the farmer's market, or we went on vacation to Puerto Vallarta, like, that seems completely disingenuous to me.
Yeah.
And that's not how I want to live my life.
But that realization took a while to happen.
Oh, absolutely. Like I said, I had all this internalized homophobia of God, I really hate that, and I think it was, you fill in the blank, right? I really hate that people have this perception of who we are automatically by one adjective, right?
Yeah.
I hate that people think that, just because I'm a surgeon that I can't be gay, right? I absolutely hated that. And it has, if anything, I feel like it only augments my ability to perform my day-to-day tasks, my ability to take care of patients, my ability to...
Oh my God, I'm sorry.
It just makes me who I am. And so, I feel like there's enough people out there who have the opposite mindset or counter mindset that, I just feel like I have to be visible, because otherwise we're living something that other people want for us and not what we want for ourselves.
So, yeah. And I think you heard me say this, but I kind of going back to your very generous compliments at the beginning, the reason I am more comfortable and have a stronger voice and am more confident, I think, is because I'm too tired to be anything but me. I'm too exhausted. It's way too much work to hide parts of me. It's way too much work to not be as authentic as I can, which I understand. I said earlier, I had my Southern accent. It still comes out sometimes.
Oh, it comes out all the time. I was being nice. It comes out all the time, honey.
Yeah. Okay, fine. The y'all slips its way out, especially. But it's too exhausting, and my patients deserve to have all of me, right? The patients we take care of deserve to have our best selves taking care of them. And what a waste of energy and what a waste of time to be anything but exactly who we are. And so I mean, even specifically addressing patients, I did not know that urologists participated in gender care until my sub-Is, right? Until I was a 4th year medical student, had already decided I want to do urology and rotated, right? I rotated here and saw vaginoplasties. I saw phalloplasties. I realized we have an entire gender clinic. I had no idea that trans patients needed urologists and that we could perform care not just for trans individuals, but intersex individuals, all sorts of patients from, whoever needs it, right? I didn't know that was the case. I didn't know that was something I could do or even help with until I got out of the South. No shade to the South, but there's no secret also that trans people and trans care is under attack right now.
Oh, absolutely.
And so I think from a political perspective, from a personal perspective, once I realized that was something I could do as a urologist, and I could support my colleagues who really, really specialize in it, I was heck yeah, I want to be in a place where I can do that. Yeah. And so, and even thinking about the way that we speak about prostate cancer, there's so many changes coming along. And I think the tide is turning, but we have such a long way to go in terms of including, when we talk about prostate cancer, sexual health, which literally we do all day long. We're so horrible at including men who maybe don't practice penetrative intercourse, or including people who have sex any kind of differently from the classic like penis and vagina intercourse, right?
Yeah.
Like we're so bad at having that conversation and really assessing a patient as an individual. So I think if I'm limiting the way that I'm living and even presenting as an individual, like obviously, like, you know, I don't walk into a room and say, "Hi, I'm Dr. Jones, I'm bisexual."
No.
But I do think that like in the day-to-day, minute-to-minute, the way we live our lives, I think being as authentic as possible is only helpful for our patients, for our team. And I think it's helped me grow and become more confident and comfortable having those conversations with patients. Because you understand, like, you understand, okay, like, I'm a little bit different. I've never had prostate cancer. I've never been discriminated against, you know, openly, as far as I know. I've never had a homophobic statement made towards me. But you can sort of help, you know, it's a step in the right direction to understand where this everybody's different. But where this patient is, where a human being is coming from and how you can help them, I think. And that has been a major evolution for me, right? When I decided I wanted to be a urologist, I didn't even know that was a possibility. Right. And now I'm like, heck yeah, what are your pronouns, right? Yeah. By the way, mine are she, her. Mine are he, his. Yeah, just to clarify.
I think it's interesting because when we talk about these types of differences, it's not always, it's a little bit more nuanced, right? Like I think
for sure.
Like I've known for a very long time. Since I was a little baby, I was Asian, I was different. I went to an all-white elementary school, all-white middle school. It was very clear that I was different, right? Because of how I looked. There was a completely different experience in terms of realizing that I was gay, right? It took a long time for me to realize that because there were no examples out there, and there were no people who were out there and living as authentically as you like that you're aspiring to be, right? And so for me, I came out like in college, and I started coming out in college, and then I went back into the closet because of what people were saying, and then I finally was like kind of circling back, but of course there was this internal homophobia dialogue in my head before it was even at the very beginning of residency, right? And I think part of it is understanding that like the experience of someone who's LGBTQ, like they weren't necessarily 5 years old and realize that, yes, absolutely, I'm part of the community, right? They've been indoctrinated with whatever perspective, what other people wanted, maybe their parents, maybe
whatever they were told they should be.
Exactly. And there's a divorce from that to then becoming who you are and realizing who you are. And that is probably one of the biggest challenges I've ever faced in my entire life.
Do you feel like you've overcome it, or there's still challenges?
I think there are definitely apps. You know, I talked to my parents are not coming to graduation, right? Like it's absolutely horrific, right?
Now I'm gonna really cry.
No. Yeah, no, I don't think that for anything other than to say, you know what, like this is my reality, right? Yeah. Like I think my family really still struggling with me, and my partner. They're very uncomfortable with the idea. There's so much cultural expectation. Like I'm the only one in my dad's family with the family last name, and he has 6 sisters, right? And like from a Taiwanese culture, like that was like I'm expected to find a Taiwanese woman and continue our lineage, which yes, in today's day and age in 2024 United States, maybe that seems a little bit narrow, right? But that was the reality that I have been living for a very long time, and that was part of what that internalized homophobia was really like circling in my head about, is that like I'm disappointing not only my parents, but I'm disappointing my family, my grandparents.
This like legacy you're responsible for, and this duty.
Yeah. It was huge. And then you layer upon that like religion.
Is it?
Wait, I mean, yeah, like my parents are probably one of the most conservative Christians that you would be. And so the fact that you layer that upon the culture made it super, super difficult. And so like there's so many layers to being able to live authentically that like, well, yeah, it was absolutely one of the biggest challenges to overcome in my life. And you with your therapist, I definitely went to therapy for this multiple times to talk about this, because I hated myself for it. I absolutely hated myself, and it affected me. It affected my life. I was not happy as a person. And so how the hell am I supposed to take care of someone else? how the hell am I supposed to operate at my best?
Yes.
Please don't cry.
We knew this was gonna happen.
Oh, no.
Oh God. Yeah, I mean, you know that like another thing that makes me like different or special is like my struggle with mental illness. And, you know, I have been working on taking care of myself in that way for a long time, right? And it's such a common thing, especially for physicians. It's such a common thing, especially during residency. Like we know how many residents and how many physicians, period, commit suicide. Like we know that like life's hard, and this is a specific type of pathology that really affects us. And, you know, you've been so instrumental for me and like helping me like wake up and come to work in the morning.
I'm not gonna cry.
That like the fact that like you being unhappy with yourself, you like disappointing yourself or feeling like you're disappointing anyone is heartbreaking.
Yeah.
And I know we've had this conversation before and now we're having it on a podcast, but like I don't fully understand, and I never will, right? Because I made my parents very happy when I got married at 21 to a white man, you know, like just because that was what was like expected of me. Like they know that, I know that, like I made them happy. And of course they've been asking for grandkids ever since, you know, like I also made my parents very happy when I became a doctor and when I, you know, matched to do a competitive residency, and I'm making them happy again, like graduating from residency. I, at the time of this recording, have not told my mom that I'm bi yet. So I'll have that conversation before this podcast airs, but I fully expect to be supported. Right. And you not having that is like, I haven't had that same degree of struggle and the work and the work on yourself. So like, I don't know.
Listen, it's not that I don't have the resources.
Comparing traumas is not good.
No, it's
my
not good.
therapist talked to me about this plenty of times, but I do have a sense of, I know how fantastic you are. I know how good you are at your job, which is like the least interesting thing about you is that you're a really good urologist, like a very gifted surgeon.
No.
Like that's the least interesting thing. But like the fact that you would ever feel less than is incredibly heartbreaking to me.
I mean, it's not to say that I never had resources. I have people in my life
Of
that,
course.
you know, I have you, I have Tyler, who's my partner. I've had our faculty.
Yeah.
I had people in our residency who were very much supportive. I had family members and friends who are very much at to a point where I can rely on them.
Yeah.
And even my sister now. Like I think it's interesting because my parents, I think, are still going through a coming out of theirs, and they're really struggling with it. And I think they're coming around. I have hope that they will come around, but they have to come out too to their friends and their family and their conservative churches and like their adult Taiwanese people who've already had kids with grandkids and like that same cultural expectation that, you know, why isn't Andrew married yet? And any like all of that, right? So they also are facing kind of a weight as well. And I think that I don't know. I'm not that kind of person who wants to cut the relationship and say, you know what, it's too difficult for me, and I'm just not going to do it. I'm gonna go into the trenches and I'm gonna work with my parents, and I'm gonna talk to them because at the end of the day, I do see them as an asset. They really are supportive. It's just for some reason they'll talk to me about everything and anything, except for when it comes to relationship. There's almost a black box, and they're just like, oh, they're so visibly uncomfortable and don't have the language to talk about it. That I almost feel like I have to be there for them sometimes as well. Yeah. And again, kind of going back to setting yourself up for success, like in the way that I get to know people in the operating room, I also have to get to know them too and give space for them to explore that. So I'm almost having to be their support network as well, which I didn't expect to have to do.
My therapist would have a lot to say about this, by the way.
I know. A lot of people are just saying, shut the corn, Andrew. It's not working.
No. Everyone's on their own journey. Everyone is just trying to be as authentic and live as well as we can and take care of ourselves and do our jobs and try to take care of everybody else. Like, that's totally fine. But I I know that everyone at work, everyone in our program, literally the urology, everyone in urology is here to support you and to like take care of you and be there for you, whatever that looks like, right? So if it does come to the point where you decide the healthiest thing for you is to sever some of those ties and maybe not participate in those relationships until they're ready, like whatever, we're here for you no matter what. And so I'm a little bit of like a little impulsive and a little bit, I feel very strongly about things, as you know. And so I'm like, oh yeah, like that relationship isn't serving you, like get rid of it. But I also haven't been in your shoes. And that's just another piece of the puzzle where you just have to figure out what works for you and just wake up and try your best every day, which I know you're doing. And it's incredibly amazing to watch.
I appreciate you validating that. Well, I appreciate you validating. So like, a lot of people have to, like a lot of the people in the past have told me actually the easiest thing to do from an emotional standpoint was actually sever the tie because it's so painful to go through with yourself, let alone going through with someone who's unwilling to go through it, right? Unwilling to come out for their loved one or anything like that. And, I think I'm just not that kind of person. I can't do it. I can't do it. And
you're not that kind of person.
No, but that ultimately will be a lot harder, right? But like you said, like like I said, alluded to a little earlier, I have people in my life, right? There are people that I've identified in my life that are support networks, that are really kind of pillars that I can lean on, so that I can have those difficult conversations when I really have to. And so I think, and that really just points to the fact that we just still have to be visible regardless of where that is. I mean, that's why I wrote that AUA piece. That's why I brought you into this podcast. And I knew we are aligned on this, right? Like it makes it so much more important so that we can kind of just be.
Which is what we all deserve. Yeah. Which is what our patients deserve. And like anyone who's thinking about, like, I think about like the undergrad, the pre-med, or the med student who maybe is going through something like this and who's thinking, or maybe even like a junior resident, right? Who's like, okay, well, like to what degree is this part of me? Is this sort of difference that I have? Like, to what degree should that play a role in what I choose? Like, is urology going to be harder for me? Is surgery going to be harder for me because I'm different in this way? And I think both of us can say at this point that the answer is no. Yeah. Like, but I think a lot of that is a credit to the environment in which we trained, which I was very intentional about, like trying to end up somewhere, right, where I would feel supported and where, as a woman, like we had, multiple female residents when I rotated as a sub-I, and I was like, okay, cool. Like I can do this here. And then, I think right now, hopefully this conversation like reaches whoever that person is, who's like, I don't know, can I be who I am in urology? Like, I mean, what do you...
The answer is yes.
Well, obviously.
The answer is yes. Okay. So absolutely. I think, I mean, if you think about where we are now and where we were like even just 5 years ago.
Yeah.
As a field, as a subspecialty, as a program, I mean, we've already come a long way.
Yeah. Oh, I agree. There's a long way to go, but we totally have. Now we're having conversations. Now there's part of like the core curriculum. There's part of guidelines in terms of like taking care of, LGBTQ patients. Like there's research money being poured into how can we best serve patients who are, diverse or different, right? So I think we kind of just go back to like being whoever we are ultimately serves everyone else, including ourselves. And I think for me, especially from an advocacy space, like I've been active with the AUA residency and fellow advocacy group, and plan to continue, that work through the AUA on a state level and a national level. Once I start my big girl
I love
talk.
for you. Yeah, I've done. This is what makes me most proud of you, because this is kind of peak Raven, right?
Oh my God. Yeah. Well, for me, I'm like, if not me, then who?
Right. That's why.
Yeah. For me, I'm like, okay, I'll be the one to step up and say, hey guys, like this could be done better, or like this group isn't getting the attention they deserve, or whatever. And it's challenging because I don't belong to every different group. Like I belong to just a subset of like these sort of, different groups, like we're checking boxes, right, on the census or whatever. But at least I can try to help. I can try to, pass the mic and let whoever needs someone to step up and have that voice, like hopefully get the opportunity. So anyway, I think as a field, I totally agree. We have the privilege of sort of like working in this really intimate space for people, and we are changing and growing and able to sort of reflect more of what our patients look like when it comes to our research priorities. And as providers and as surgeons, we're like, okay, yeah, I can take care of you because I know you and I look like you. But again, there's only 2% of urologists are Black, right? Like we have such a long way to go. Such a long way to go. But I agree. We've come leaps and bounds. Yeah, we've made a lot of progress.
I think we can even have this conversation.
Yeah, that's true. Who knows if it'll make it to air? But yeah, like I completely agree. Like the fact that we're able to talk about our sexuality, like as urology residents. Openly, comfortably, I think that's pretty major. I think, the future is pretty bright. Do you agree?
I agree. I'm hopeful.
Me too. I'm optimistic.
I think that we just have to continue to be visible because there's someone out there who can do this. There's someone out. I feel like when I was in research here, I was looking for someone who was kind of like me. And it was pretty hard to find somebody. And so that's when I realized, okay, I'm probably going to have to trailblaze something myself and just like let it happen. And if other people see me, great. But I'm going to have to stand on my own 2 feet grounded and say, hey, like this is going to happen for me and I'm going to make it. And hopefully that doesn't have to be the case for everybody, right? Like people struggle with a little bit of the agency or the resources or the location or the safety to be able to be themselves. And I can't believe we have to even say that in 2024.
Well, I that's the exact same thought process I had when I went through during my 5th year.
Oh, yeah, let's talk about this.
Well,
Han, you want to talk about this?
Yeah, sure. Okay. So during my 5th year, we do sort of an off-site rotation. So this wasn't, UIC as a whole has been incredibly supportive. Our program has been fantastic. Our faculty are wonderful. But I encountered an attending, at another site, not a part of UIC, who, was historically not the most polite, had a history of like really bigoted behavior. And I had heard about this person. And as soon as I started working with them and interacting with them, I realized that it wasn't a safe environment for anyone, but especially not anyone who may fall under whatever diversity umbrella, right? So as a woman, I was hearing there were a lot of comments made about my body, a lot of sexually explicit situation, like just, it can be summed up well in terms of the word like sexual harassment, but that sort of bigoted behavior wasn't the only thing. Like there were homophobic comments.
There you were trying to warn me about.
Yeah, there were racist comments. Like there were so many terrible comments. This person just, did not create a safe work environment for anyone, but especially for residents who are in this sort of uniquely vulnerable position where we're employees, but we're also trainees. And it's not like we can easily just sort of be like, oh, this doesn't work for me. Like, bye. Which I think, again, is something that is rapidly changing. And I think UIC as a whole is incredibly supportive of residents who have this experience because that's what I experienced, right? Like as soon as I spoke up about it, like I was removed from the situation, had that support. And, now like that's not anything that anyone coming behind me has to worry about.
Oh, and you know what? Thank you so much for talking about it because I didn't have to go through any of that.
Well, that was my whole reason.
And so I think that's
the whole reason I spoke up.
But that was incredibly brave. And it was incredibly we always hear horror stories about whistleblowers being like, XYZ facing some kind of repercussion.
Oh, yeah.
I mean, but at the end of the day, the people who come after you, including myself after on that rotation, like made it so much better for me, right? Like I remember kind of having to prepare myself mentally about things I would say as comebacks or things I would say to kind of buff up against any type of comment, right? Which we would never expect to have to say or think about in today's day and age. But it was, I mean, like, all I can think of is just being so appreciative of you even just like stepping up for that. I mean, I feel like I wish there were more people in the world that would do that.
Oh my
And I
God.
think a lot of things would be moving forward a lot quicker if that were the case. But, you know, at the end of the day, like, this is something that I think was so like defining for you.
Personally, for sure.
Yeah.
Yeah.
How we talked about it, it seemed like it was so defining, but like it's something that makes me only more proud because it has really made you the person you are, and you have developed such conviction for what you think is the right thing for everybody, and the advocacy that you then present and fight for people going forward. I mean, I feel like that really was that one of those defining things that really makes you the best person that you are right now.
Oh God. Oh, God. Well, I will say, like, in my brain, when I think about residency, like, there's a very like distinct sort of before that incident and after, right? And I completely agree that, you know, my motivation 100% was, I can't let Andrew go through this. I can't let, you know, the next like LGBT person go through this. I can't let the next non-white person go through this. Our beautiful group of residents are so diverse and are such like lovely humans, and you know that everyone is, right? Like everyone has, you know, something that's different or special about them. But I just knew that in this particular scenario, I could not let anyone else, especially anyone who, you know, was a member of the LGBT community or whatever, I could not let anyone else have that experience.
That's so powerful. Seriously, like, because I think that we, like, even when we talk about resources outside of our traditional family network, and that's why you are absolutely someone in my network that I know I can just in the future call up and say, hey, I had a really shitty thing. I need to debrief with you, or hey, something happened to me and I need to talk about it with you. Like it's something like that where I'm like, it doesn't have to be your traditional family network. Yeah, someone that you identify like and find that just becomes part of your support network, and I think that's so important for a strong community.
Yeah, I mean, I have had to lean into it. Like I've had to sort of rely on that community so much for me because I'm so far away from home, right? And I intentionally like I chose to move to a more, you know, sort of progressive area for sure. But I also like put that distance between myself and my family. And then when you're in residency, like things happen, right? Like I've lost family members. Like during COVID, I couldn't go to my grandmother's funeral and had to watch it on Facebook Live and they mispronounced her name. Like I lost a brother to COVID. Like life doesn't stop happening just because you're in residency, which, you know, everyone knows. And life doesn't stop happening just because you're a busy surgeon or like you're working, you know? And so I think I think this goes along with living authentically is if you can be your authentic self at work, if you can be as honest as possible about who you are, then you're able to cultivate those relationships and really lean on those around you when you need it, right? Like when things aren't perfect, right? When you do have a rough day, when something terrible is happening. So because that stuff doesn't stop. And so I'm actually really proud of us for cultivating that culture. Don't you think? Like, well, I think it existed before us.
No, but you and I agree. Culture is something that is actively cultivated, right? It's not something that is passively experienced.
Yeah.
So I think we've done it. I am proud of us. Yeah. Kind of cultivating that kind of culture where we can absolutely rely on each other and we absolutely can have juniors come up to us or even talk to our juniors when we're having bad days and experiences and kind of debriefing and really just sharing them a little bit of that stress. Yeah. Because ultimately, residency is stressful. The job is stressful. Being a surgeon is not a cakewalk. Yeah. No. You know, and so I think it's really great that we actually have that.
Yeah, I completely agree. I think a lot of it did exist before we got here. But I also think that the work that we've done to ensure that it stays after we leave is I mean, talk about legacy. Like, that's the legacy. That's what we want. And that's what we've done. I think we can be very honest with ourselves and be proud of ourselves for cultivating that and for sort of having that be what we leave behind. How did we get here?
How did we get here?
Yeah.
Seriously.
Yeah.
Wow. How did we get here?
I could go on for days
I know I could
about how obsessed I am with you.
I'm good too.
But
no, seriously, thank you for talking to me, because I think this is everybody doesn't necessarily know this, but we have these conversations a lot. And I think we can continue having these conversations. Honestly, I think it really helps both me, but I think it also helps you
100%
continue to stay grounded and continue to stay passionate about what we love doing, which is treating patients, which is urology, which is really just being our authentic self. And I think how we got here, honestly, I think we think about how we got here, and I think about, like, man, we decided when we were interns that we were going to lean into each other.
Yeah. Oh, the first minute.
Yeah, we were just like...
The first minute you introduced me at that computer lab, I was like, oh my God. I was like, this is him. I was like, this is my missing piece. Like, this is my twin. Like it was instant.
But it's leaning into each other.
Yeah.
And, like, so thank you.
Of course.
I didn't say that enough. No, seriously, yeah.
Well, let's say, okay, do you have any advice for anyone who may be queer, who maybe not whatever the sort of, I don't know, the majority is? Do you have any advice for someone who may be starting their journey in residency, in terms of what challenges they may face, or any sort of piece of a nugget of wisdom for them as they start this process and this journey?
Yeah, so one of my best friends in dental surgery actually just gave her grad rounds, so I'm so proud of her, Christina.
Yeah.
But it's a talk on it's a nod to vulnerability.
Very Brene Brown.
Yeah, very Brene Brown.
Yeah,
but it's
we love it.
Right, absolutely.
It's science.
It is absolutely science, and I think that it's something that I think we as surgeons have a difficult time experiencing. And I think that being in the LGBTQ community, like, you're almost forced to feel vulnerable on a day-to-day basis all the time in different situations. And I think rather than being fearful of it, us embracing it, and when safe, but like embracing being vulnerable, and kind of trusting that the people who see that vulnerability will really respond to it.
Yeah.
And in fact, they will almost flourish around you, and together you can become like this wonderful community.
Oh, that's such good advice.
So I think that is really when I think about, like, I mean, part of this is also, thank you, right? Like, thank you for creating a space where I can be vulnerable, right?
Likewise.
But like, that's how we got to be stronger, right? That's how we were able to articulate how we felt about difficult encounters and difficult experiences, was being comfortable and knowing that, like, I experienced X, you experienced Y, and it really sucks. And to not feel like why do you feel that way? Right? Like, not, or to not
have been go to work.
Right, exactly. Or to not have this feeling validated by any means, right? Like, it was kind of how we became stronger, because it was a way of us being able to then articulate that experience and kind of grow from that, right?
And it's this like self-fulfilling sort of process that when you are vulnerable, you extend vulnerability and you get it back, and it creates that same safe space and safe environment for the next person. So I think that's part of our legacy, don't you think? Yeah. Cheers.
Cheers. No, seriously, thank you for creating the space with me, and I appreciate it. I cannot wait.
Literally anytime. It's been 6 years. We're almost done. Wild.
This has been Voices, an AUANews Inside Track podcast, and is brought to you by the Diversity, Equity, and Inclusion Committee. For more information about the AUA's diversity, equity, and inclusion efforts, visit auanet.org/diversity.